We have been telling you this afternoon more businesses in Massachusetts can open their doors to more people starting on Monday. New week, new month. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, it's always great to see you. So as we've mentioned, the list of businesses that will be able to operate at 50% capacity is long. Theaters, churches, health clubs, museums, office spaces. Do you believe these places are safer today than they were just a few weeks ago?
I think so, Ed. Remember, we just hit our peak in sort of mid-January. So we're seeing cases go down, hospitalizations are down, deaths are decreasing. So this is all good news. I think also testing positivity is decreasing. So looking at capacity and all of these good metrics, of course, we have to improve the livelihoods and get the Massachusetts economy going again. But remember, we still have to double down on the infection prevention measures, even as we move indoors more.
The masks and the hand washing and the social distancing, keep that foremost.
Absolutely.
Yeah.
Hello, doctor. Do you feel, before I ask you the next question, I think I've asked you this for a year now. Do you finally feel optimistic based on all of this? Vaccines are coming in, things are being lifted. Just a yes or a no, I guess. Or maybe.
Yes.
Okay.
But I'm concerned about the variants, but I am absolutely optimistic.
All right, we'll ask you about that in 1 second. Let's talk about this. Yeah. Governor Baker says he's removing the capacity limits for restaurants. All tables have to be 6 feet apart. So do you think that that offers enough protection indoors based on all of this?
Well, I think it makes sense. The one thing I'm going to highlight, Maria, is I still think that vulnerable people who haven't been vaccinated, probably best to avoid the indoor dining right now. But if you're vaccinated or if you're in a lower risk population, I think it's reasonable to go indoors.
So we know that the COVID-19 virus is mutating. That's what you were just talking about. Tell us about this new variant that's been detected. Every time it seems like we report on a new variant, we're able to say, well, this vaccine is really effective against it. So what's the latest on this?
Right. So this is the 526. I mean, there's all these different numbers. This is from New York. So I think what we're seeing is convergent evolution. That's a fancy name for saying, think about mutational survivist of the fittest, okay? Survival of the fittest. So these viruses are kind of getting stronger, and they're developing these mutations independent of travel, so different parts of the world. This specific variant has a similar mutation to the one that was first identified in South Africa. So it's concerning. It may be able to evade the immune system. But remember, even as this variant is increasing, we're seeing cases go down.
Right.
That's good news. And hopefully the vaccines still keep people out of the hospital.
We bring up, and you touched on a lot of important topics each week and each time we talk to you. But last week we seemed to touch something that a lot of people were interested in. We were talking about the state's list of comorbidities, and a lot of viewers were focused in on type 2 diabetes. On the list, type 1 is not. So do you think there is a chance that that could change?
Look, I'm just going to say it, Ed. Type 1 diabetes needs to be on the list. But what the state, the command center has done is they're following the CDC guidance, and they have two different lists. Diabetes type 2 is on the first list. Type 1 is on the second list. We will see a change. I can't tell you exactly when, but my partner went back to her committee to discuss the importance of this.
Dr. Ellerin, so great to see you as always.
Thank you, doctor. Be well.
Thanks for your time. Have a great week.